How does vagotomy surgery treat ulcers? Imagine a tiny nerve in your body that controls how much acid your stomach makes. That nerve is called the vagus nerve. When someone has a severe or stubborn stomach ulcer, doctors sometimes perform a surgery called vagotomy to help. This surgery works by cutting or interrupting branches of the vagus nerve that tell the stomach to produce acid. Since excess acid can worsen ulcers or prevent them from healing, reducing acid helps the ulcers get better. The vagus nerve normally stimulates the stomach's acid-producing cells directly and also causes the releases of a hormone called gastrin, which increases acid production. By cutting these nerve signals, vagotomy significantly lowers the amount of acid in the stomach. This creates a more favorable environment for ulcers to heal and reduces the chance they will come back. There are different types of vagotomy. One is called truncal vagotomy, where the main trunk of the nerve is cut. Another is selective vagotomy, which only cuts the branches that supply the stomach, leaving other functions intact. A highly selective vagotomy targets only the nerves to the acid-producing part of the stomach. These variations aim to lower acid levels while preserving as much normal stomach function as possible. Vagotomy is usually reserved for cases where ulcers are severe, recurring, or causing complications like bleeding or blockage, and when medications like proton pump inhibitors or antibiotics for infections like Helicobacter pylori do not work. Often, vagotomy is combined with pyloroplasty, a procedure that widens the opening from the stomach to the small intestine. This helps the stomach empty properly and prevents issues like gastric outlet obstruction, which can happen if the stomach doesn't empty well after surgery. Sometimes, vagotomy is done along with antrectomy, which removes the lower part of the stomach that produces gastrin. Removing this part can further decrease acid production. But because antrectomy alone might not prevent ulcers from coming back, doctors often perform vagotomy along with it to improve results. While vagotomy was once a common treatment for ulcers, especially before effective medications were available, today it is mainly used for cases that do not respond to medicines or have serious complications. The surgery helps by lowering acid levels, promoting healing, and preventing future ulcers. However, it does carry risks, such as delayed stomach emptying, which is why procedures like pyloroplasty are often done together to help the stomach drain properly. In summary, vagotomy treats ulcers by cutting the nerve signals that tell the stomach to produce acid. This reduces acid levels, allowing ulcers to heal and lowering the chance of them coming back. It is generally used in advanced or complicated cases and often combined with other surgeries to improve stomach function and prevent complications. Always remember, if you or someone you know is dealing with ulcers, it's important to consult a healthcare professional for personalized advice and treatment options.